Hello and welcome to our video on appendicitis, the condition that makes your appendix wish it had taken a gap year. If you've ever experienced sharp pain in your lower right abdomen, you know that appendicitis is no joke. But fear not, we're here to give you the lowdown on what causes it, how to spot it, and what to do about it. So sit back, grab some popcorn, and let's get to the guts of appendicitis. The appendix is a finger-like pouch attached to the large intestine. It is located in the lower right area of the abdomen, or belly, near where the small intestine attaches to the large intestine. The human appendix averages 9 centimeters in length. The position of the base of the appendix within the abdomen corresponds to a point on the surface known as McBurney's point. It is a landmark used in clinical examinations to diagnose appendicitis. The point is named after the American surgeon Charles McBurney, who first described it in the late 19th century. The appendix is considered a vestigial organ, which means it has no known function in the human body. While it was previously thought to be a useless structure, recent research suggests that the appendix may play a role in the immune system. Some researchers believe that the appendix may serve as a reservoir for beneficial bacteria that can help to repopulate the gut after a gastrointestinal infection. Additionally, the appendix contains lymphatic tissue, which is an important component of the immune system. However, more research is needed to fully understand the functions of the appendix. Despite this, it is important to note that the removal of the appendix does not appear to cause any significant health problems, indicating that it is not essential for human health. Appendicitis is the inflammation of the appendix. It can be caused by several factors. In many situations, the primary cause is unknown. Potential causes include solid stools or growth that can block the opening inside the appendix, or swollen tissue in the appendix wall caused by an infection in the digestive system, or elsewhere in the body, and inflammatory bowel disease. Appendicitis is most common in adolescents and young adults, but it may happen to anyone regardless of age, including older adults. Males are affected slightly more than females. The most common symptom of appendicitis is abdominal or tummy pain. The pain in the abdomen may begin at the belly button and travel lower and to the right. It may begin abruptly and even disturb sleep. The pain may be exceedingly unpleasant and unlike any other pain you have felt. It may occur before any other symptoms and intensify in a matter of hours. Other symptoms of appendicitis may include loss of appetite, nausea or vomiting, fever, swelling in your abdomen. However, some people with appendicitis, especially children, may not have any of these common symptoms. If you or your child is experiencing pain or discomfort, seek medical attention right away. Some patients who have appendicitis may also have digestive issues, such as constipation or diarrhea, inability to pass gas, or the feeling that having a bowel movement will relieve discomfort. The diagnosis of appendicitis involves a combination of physical examination, laboratory tests, and imaging studies. The first step in diagnosing appendicitis is a thorough physical examination, which includes assessing the patient's medical history and performing a physical examination of the abdomen. During the physical examination, your healthcare provider will apply pressure to McBurney's point, which corresponds to the location of the base of the appendix. If the appendix is inflamed, this pressure will cause tenderness and pain in the area. However, it is important to note that not all cases of appendicitis present with tenderness at McBurney's point, and other diagnostic tests may be necessary for a definitive diagnosis. Your healthcare provider may also check for other signs of appendicitis, such as fever, vomiting, or loss of appetite. Laboratory tests are also used to help diagnose appendicitis. Blood tests may be performed to check for signs of infection, such as an elevated white blood cell count or an increase in C-reactive protein levels. Urine tests may also be done to rule out other potential causes of abdominal pain. Imaging studies are also commonly used to diagnose appendicitis. Ultrasound, CT scan, and MRI are all imaging techniques that can provide detailed images of the abdomen and help identify inflammation or other abnormalities in the appendix. These tests are also useful for ruling out other potential causes of abdominal pain. In some cases, a diagnosis of appendicitis may be uncertain, and your healthcare provider may order observation and further testing to confirm the diagnosis. This approach may be necessary if the patient's symptoms are not severe or if your healthcare provider is uncertain about the cause of the patient's symptoms. The diagnosis of appendicitis in young children and the very old is particularly problematic, since other causes of abdominal emergencies are prevalent in these populations, and the very young and the very old are also more likely to have atypical clinical presentations. The treatment of appendicitis typically involves surgical removal of the appendix, a procedure known as an appendectomy. This procedure is typically performed as soon as possible after the diagnosis of appendicitis is made, as delaying treatment can increase the risk of serious complications. The longest appendix ever removed was 26 centimeters long. I won't go into the specifics of the surgical procedure as it is outside the bounds of this discussion. In addition to surgery, antibiotics may be prescribed to treat any infection that has developed as a result of the inflamed appendix. Anyone who might have appendicitis can also be treated with antibiotics before surgery. Some people may improve with antibiotics and not need surgery. Pain medication may also be given to help manage pain and discomfort after surgery. After an appendectomy, most patients can return to normal activities within a few weeks, although it may take longer for more strenuous activities or heavy lifting. It is important to follow your healthcare provider's instructions for post-operative care and to attend all follow-up appointments to ensure a full recovery. In rare cases, complications may arise after an appendectomy, such as infection, bleeding, or damage to surrounding organs. If you experience any symptoms of complications, such as fever, severe pain, or difficulty breathing, it is important to seek medical attention immediately. Unfortunately, there is no guaranteed way to prevent appendicitis, as the exact cause of the condition is not fully understood. However, there are some general steps that you can take to reduce your risk of developing appendicitis, like maintaining a healthy diet, staying hydrated, practicing good hygiene, and managing any underlying medical conditions. To summarize, the appendix may appear to be an insignificant organ, yet it plays an important function in our immune system and digestive health. Appendicitis is a common condition that affects many individuals, and it can cause serious complications if left untreated. As a result, it is critical to be aware of the signs of appendicitis and to get medical assistance as soon as possible. And that's a wrap for the video about appendicitis. I hope you found it informative and entertaining, and that you're now an expert on all things appendix related. Remember, if you ever experience symptoms of appendicitis, don't wait until it's too late to seek medical attention. Thanks for watching, and we'll see you in the next video, hopefully, one that's a little less gut-wrenching. Don't forget to like, subscribe, and share to protect your loved ones from the wrath of appendicitis.